Hi everyone, this is a slide presentation about theories of health behavior. We will be going over some of the major health theories that clinicians and providers use every day to help treat clients and give them the best possible outcomes. Theories. Why are theories important in healthcare? Theories help us understand patient situation and craft interventions. Theories help provide guidance to providers so that they have some frame of reference with understanding patient behavior. Theories also connects practice to research using shared language and clinical realities. We also know that theories of health behaviors um, are seldom offered in traditional social work curriculum. Um, you tend to find theories of intervention and practice more in your clinical courses, but related to health behaviors, there is not much theories provided related to health behaviors for clients. Theories represent bodies of knowledge about human behaviors, and they inform our skills. They help us understand why clients do what they do, why they respond the way they do to illnesses and diseases. And they also allow us to understand a lot better why they take a specific course of action related to a disease course. So in that way, theories inform interventions and improves the likelihood of outcomes because they better position clinicians to address the needs of clients by understanding their behavior. So theories inform practice and practice informs theory. There are two types of theories when we're thinking about applying theories. One set is called orienting theories and the other is called health behavior theories. When we're thinking about orienting theories, we're talking about theories that are applicable to problem behaviors. Orienting theories tend to be used in many areas. One example may be motivational interviewing. That's a behavior. Motivational interviewing is usually applied to people when you want to correct behaviors or enhance behaviors toward a more positive trajectory. Motivational interviewing can also be used to treat many issues concerning patients. It's heavily used for substance abuse. It can also be used in child welfare as well when you're trying to help patients or clients overcome a set of problems that they are experiencing and wanting to help support them and motivate them to a more positive course of action. Similarly, health behaviors can be applied to all behaviors as well, not just problem behaviors, such as orienting theories. And health behaviors tend to be specifically used in areas of health rather than used in many areas like orienting theories. However, there are a couple of orienting theories that are used toward health behaviors. Examples include the ecological model and the trans-theoretical theory are not necessarily health behavior theories, but they're orienting theories that are applied to health behaviors. So attribution theory, also called self-efficacy concept, it's not a official theory, but some refer to it as a theory, but it's more of a concept. And it asserts that people try to assert control when they are provided with very little control. Control is established by offering explanations or causes for what happens to them. In this theory, clients are or they perceive themselves as having very little control over what's going on with them, such as a diagnosis of breast cancer or a diagnosis of HIV. And so their behaviors may tend to gravitate toward ways to control what it is that is going on with them, or provide some kind of measure of control over their life so that they can address the health issue. And sometimes this control is providing alternative explanations for what is going on with them. Also, attribution theory is there's a belief that life is subject to chance and is considered low self-efficacy. So when you're considering someone who doesn't feel like they have control over what is going on with them, be it a health diagnosis, they will use lines or say statements such as, it was going to happen anyway. It was a bad run of the dice, is what has occurred to me. That is considered somebody with low self-efficacy. The belief that they are not in control of what is going on with them, whether that's a disease course, what is going on with their body. And so they're less likely to assert control over what is going on with them. Someone who is considered high control, and really have a good grasp, or can at least to some extent control what is going on with them in their body, is a person that is considered high self-efficacy, or considered with having high self-efficacy. People who have high self-efficacy tends to have decreased stress. They also tend to engage more in positive health promotion behaviors. But the reverse is true with people with low self-efficacy. Because they feel like they have no control over what is going on with them, they tend to adapt a more learned helplessness style. There are 3 dimensions to consider when you're thinking about attribution theory, and that is internal versus external. That is whether what is going on to them is caused by themselves, or if they feel like what is going on with them is a result of some external influence. So sometimes people who have an internal position related to a health diagnosis may feel like what is going on with them is either payback for something they've done in the past, or they feel very guilty about what is going on with them. And so they try to look within themselves, or behaviors that they have participated in that may have caused what is going on with them. From an external position, people who are demonstrating attribution theory thinks what is going on with them is caused by external, and they don't take responsibility for the causes of their health ailments. Also, another dimension to consider in attribution theory is global versus specificity. Whether that person thinks there's one explanation for what is going on with them, or can identify many factors that may be the cause of what's going on with them. Another dimension is stability versus instability, whether something is a lasting factor or a transient factor. So in this case, a client is either looking at what is going on with them as something that's going to plague them for a long period of time, rather someone who feels like it's something that will pass in a relatively short period of time. When we think about attribution theory, we're also considering other elements such as negative attribution, which is what we also call learned helplessness, or pessimistic attribution style, which is internal, meaning coming from within, with also one explanation for many factors, and is considered more stable and lasting, and it's more applied to bad events. So an example of pessimistic attribution style is someone who feels that they cannot overcome what is going on with them because they lack the capacity within themselves to address the issue. This can be somebody who feels like they're too weak to deal with the problem, or may feel like this is just another bad incident that is related to a series of negative things that have happened in their life. Also, they tend to take a more global look in a way that they, instead of considering how many factors could have contributed to what is going on, they tend to look at that one explanation for that factor. And then also those people who tend to have pessimistic attribution style tend to have this lasting negative view of their lives. This isn't something that is passive and lasts for a couple months. This attribution style tends to be applied throughout the course of their life, and you may be able to see patterns of this pessimistic attribution style. So again, one explanation for many factors that may have contributed to a negative situation, and then also looking oftentimes within themselves as the reason for why things are going on with them. And again, these pessimistic attribution style tend to be a long-term method of how they tend to address issues. Also, patients with pessimistic attribution style tend to show passivity, diminished problem-solving ability, and decreased protective factors when facing illness. So again, they're not so good at identifying supports and protective factors that can help move them forward with what is going on with them. They tend to find one explanation for what is going on with them, which decreases their ability to problem solve and find other factors that may also be contributing to the problem. And they tend to be passive in that they are not very well at, they don't do very well at being proactive in addressing the issue and addressing the issue head on. Another theory of health behavior is the health belief model, and it explains the willingness of patients to partake in a course of action. There's two components to the health belief model: threats as well as outcome expectations. Threats are perceived as a person's susceptibility to a health condition or illness. Outcomes expectations are perceived benefits for a course of actions, how that person views what the final results will be based on a particular illness or health condition. And again, this is based on their perception of what that outcome will be. The health belief model is an empirically supported theory, and it is very good at predicting health outcomes. And it's used in a variety of health conditions, as well as it is used to explain a lot of health behaviors as well. A related concept to the health belief model is the theory of reasoned action, and it assumes a level of perceived control over behavior. And then there's a belief that the behavior is determined by intention, so that's purposeful. And that behavior, the intentions of that behavior is determined by a person's attitude, as well as their influence and the influence of significant others in that person's environment. So when you're thinking about theory of reason action, excuse me, what you're assessing here is how someone perceives that they have control over not just their behavior, but how that control over their behavior can help influence the outcomes related to somebody's health condition. And their behavior that they choose to adopt is purposeful and meant to help to address that health problem. And again, when you're thinking about their intentions related to their behaviors, you're assessing their attitude, how they feel that behavior will impact that outcome in a positive or negative way. But you're also looking at how the significant others in that person's immediate environment is influencing those behaviors and that attitude that that particular person decides to take related to their illness. The theory of reason action has two components related to behavior. And that is behavior will produce a given outcome and how important that person thinks that outcome is. When thinking about the theory of reason actions, you're looking at two components, the behavior that will produce a given outcome, or that's the reasoning that the client is taking, that the behavior that they're exemplifying or the behavior that they will take a part in will produce a specific outcome. And then also how important that outcome is to that client. Social norms play a big role in the theory of reasoned actions. Social norms are beliefs about what the valued others will think about a given behavior and the motivation to comply with the opinion of valued others. In this theory, social workers really need to focus on the environment and the support system of a particular client, because it's believed that the social norms that are brought about within that social support system will influence the client's behavior and will influence that client's behavior toward an outcome that that client feels will occur. And again, how important that outcome is to that client will also be a big part in the behavior as well as that support system of that particular client. We also have theory of planned behavior, which I think falls closely also within underneath the health belief model. And it posits that strong intentions are not enough, and that it assumes that the perceptions about behaviors control, influence behavioral outcome. So the perceptions about behavioral control influences that outcome for that client. And it assumes perceived behavioral control reflects past experiences with problems. So however that client has experienced problems in the past will influence how that client feels their ability to have control over that problem at that given time. And a past inability to engage or control a behavior would influence that client to believe that they have a decreased ability to manage that behavior at that given point. Another theory worth noting is the social actions theory, and this theory posits that social and environmental factors influence the cognitive process. And it's a three-dimensional model that incorporates self-regulation, larger environmental context in terms of influencing personal change mechanisms, and the interrelatedness of those change mechanisms. The social action theory, a person's desired state is influenced by what is needed to achieve the goal. Is personal safety needed? Is social influence needed to achieve that goal? Is material resources the desired need? How about the need for intimacy? Either way, the person's desired state is connected directly to what they feel their needs are at that time. Health decisions are then influenced by their social networks, and social networks are active players and mechanism for action within this theory. Social networks strongly influence the success of attempts to alter behaviors. So again, a social worker's role within this theory would be to understand who the players are in that particular client's social network, and how those players influence the motivation or the desired state for that client. And understanding that those social networks most likely are strongly influencing attempts for that client in terms of the desired behavior. And also being aware that that client's motivation will be informed by past attempts, and specifically if those attempts were successful or not. Another health theory is the behavioral model of health use, which focuses on health services use as well as the outcomes of health behavior, and it considers the social determinants of health. The behavioral health model identifies predisposing factors such as demographics and beliefs, enabling factors such as social supports and insurance, need factors such as health problems, and the external environment. Customer satisfaction was added at a later point to this model, but health behavior is included as an endpoint. And this also is a strong empirically supported model. And I'm going to go back just a little bit. So again, this model focuses on how clients use health services, and then how the use of those services influence the outcomes of their health behaviors. So again, you're looking at such factors such as those predisposing factors. This could be somebody's religion, somebody's belief, overall belief about a health condition, demographics, where they live, age, race. Those are all important predisposing factors that you want to consider. Also, the behavioral use model also looks at their support systems and their ability to enable them for health services use. Does this person have access to transportation? If not, do they have a family member that can bring them into their appointments? And is the use of that support improving the outcomes of this person's health and influencing their behavior in a more positive trajectory? Also, does this person have health insurance? And is that, for an example, a reason why they are not using services because they feel like they don't have the ability to pay? And is the lack of health insurance influencing their health behavior and then resulting in poor health outcomes for that client? Or, for example, what is that particular client's needs related to the health problem? Do they need a cane, for instance? Do they need medication? You know, is their use of health services reflective on the needs that they have related to their health problem, and those needs aren't being met? And again, the external environment. So they're looking at many factors specifically, and how those factors impact how someone uses health services, and then at a later point looking at the outcomes of that health behavior. So the trans-theoretical model, as stated earlier, is not a health behavior theory, but it is a theory that can be used for health behavior. There are 6 stages in the trans-theoretical model, and these stages are called the stages of changes. And they help assess an individual's readiness for change. The first stage is pre-contemplation. The second stage is contemplation. Third stage is preparation. Fourth, action. Fifth, maintenance. Sixth, termination. In the pre-contemplation stage, there is no intention to change a behavior. And in this stage, oftentimes clients do not even know that they have a problem, or they're not willing to accept that they have a problem. In the contemplation stage, they're aware of benefits of change, but they're also aware of the challenges and the difficulties that come with that change as well. So they're thinking and they're weighing the costs and the benefits of the change or the behavior that they want to change. The third stage is preparation, where they have made the decision to make that change, and they're actually making the concrete action plan that they should take in order to move forward with that change. And then the fourth is the action, where they actually take the action that is needed, and they're actually in the process of modifying their behaviors with whatever that plan is that they talked about earlier. And then the fifth is maintenance, where they've achieved the behavior, but now must focus on avoiding relapse into those negative behaviors or those problem behaviors that got them in the situation they are in the first place. So when you're thinking about the trans-theoretical model, it also includes intrapersonal and social components of health behaviors. The change is ongoing and considered incremental and nonlinear. And when you're also thinking about the trans-theoretical model, it understands that the client from their larger system and also meets the clients where he or she is at that time. So when you're thinking about these theories of health behaviors, you want to also always be considering, how can health theory benefit social workers? How can we use what we know about these theories to help understand what a client is presenting to us, understanding why they are conceptualizing a health condition the way they are, understand why they are choosing a specific course of action or intervention related to their health problem. And again, all this is valuable information for social workers, because understanding why they are making decisions helps inform how we provide education related to the illness, if that's needed. Maybe providing that education to their social support network, if we feel like that is heavily influencing that client's decisions. It also helps us with supporting clients, if necessary, by taking a more holistic approach to their larger environment and seeing how those factors are playing into their decision making. So again, each of these models and theories have a benefit to clients. Usually the trick is integrating these theories into actual practice, or being able to identify the behaviors and being able to place them within a theory. Like all theories, health behavior is now no different than your orienting theories, in that sometimes one theory does not explain a batch of behaviors that a client may be displaying to you at a given time. However, there may be some actions that a client is taking that may be explained by one theory, and then there may be other behaviors and actions that may be better explained by the other ones. Also, even though we identify some of these health behaviors as theories, some of them are just concepts that can be applied as well. So again, some of them are not official theories as mentioned, but that doesn't mean they don't do as good a job predicting some of the behaviors that you may be seeing with clients. Sometimes also, when you want to think about these health theories, you want to determine which populations and which health issues tend to be better explained by which theory. If you are in your internship or your practice at this time, think about some of the clients that you've come to contact with, that you did assessments with, you provided intervention with, and see if any of these social healthcare or these healthcare theories informed your social work practice with that client. You can also use a given theory to examine how your patients conceptualize their problem, how they behave, or how they use their environmental resources or use the healthcare resources themselves. You can also analyze your patient's service using the behavioral models of service use. So if you have if you work in an outpatient clinic or you are in a school setting, you can also use these healthcare models to determine how, for instance, students utilize the wellness program in the school. Or you may want to use a theory to help the behavioral model of service theory. You might want to use that to decide how often patients come in for their appointments. What is it explaining the missed appointments that they may have? Clients are oftentimes labeled as non-compliant, but sometimes by using these theories, we can demystify the non-compliant patient and be more clear in terms of what is motivating them in terms of need. what are some of these social supports that are in place that may be or not in place, that may be why they are not utilizing services or resources to their best ability. And you also want to examine the behavioral changes you see in your patient population using the stages of changes model, for example. So there are ways that they can be applied in a given situation. And I challenge you to start thinking about your clients and your internships and see if you can utilize these theories to help understand their health behaviors. Also, when you're writing your papers and talking about health issues, see if you can identify what theory may apply to what you tend to see as common behaviors related to an illness or intervention or a medication, for instance. Either way, I want you to start being more cognizant of these health behavior theories and using them to conceptualize how you understand not only just your practice with clients, but others as well. Thank you for taking the time to listen to this PowerPoint presentation.